things. So, hi, good afternoon, everyone. It is a different bookless cultural center, the People's Residence, coming live to you again today. I hope that you are well after the long weekend. I hope you did something kind of cool with your family because we had like 1.5 days of really good weather. Yesterday it rained, but anytime it rains, it just washes bad things away. And of course, plants rejoice because they can't grow. Now, people talk about communication all the time. People talk about communication over the electronic platforms with Zoom. People talk about we communicated in the past with drums, with smoke signals. Oh my gosh, communication is something that human beings need and human beings thrive on. But here is the thing. One of the greatest ways of communication is, okay, I could hear the world shouting it back at me. Word of mouth, word of mouth. You know something about somebody and you feel so excited to tell everybody about this thing that you know that you share it. And so I had the good fortune of having a friend who visited the great nation of Cuba. And when he came back, he could not stop talking about the awesome things that always take place in the country, but he also spoke with such great pride about an individual who he holds in the highest esteem. Now, when I heard about that individual, word and mouth again, communication, I got excited too, because that individual is a doer. Engage. And not only that, the thing that made me very excited is that she's also writing her names on history's page. And her expectations in history, I know, are great. Okay, so there are lines from the Barbados national anthem. And I'm now going to talk and introduce somebody of Guyanese ancestry and descent. And this is the incredible Dr. Kelecia Niles, who my friend told me about on his current recent visit in Cuba. Let me introduce her to you. Dr. Kelecia Niles is a third-year cardiology resident in Havana, Cuba. She graduated with honors in 2013 from the University of Havana, and she served as a general practitioner in Guyana for 3 years. And then get this, young people, if you're listening, this is what her job and her work enables her to do. And then she went on for a stint into China and participated in work that spoke to platelets. Oh my gosh, there's so many scientific things that she is involved in that I cannot sometimes even pronounce the names, or I even know what I'm talking about, but I know it is profound and it is good and it is rich. Currently, she's involved in her studies in Cuba and her work there. And upon graduation, congratulations, this needs a drum roll now. She will join the ranks and become one of the first 4 Guyanese cardiologists. Oh my stars, the whole world is cheering for you, but I want to extend a very big warm welcome to the People's Residence, a different bookless cultural centers, television, and I want to welcome Dr. Kelecia Niles. How are you today, Dr. Kelecia Niles?
Hi, I'm for the wonderful welcome. It's a pleasure to be a part of this lovely platform.
Thank you. Now I told you her creds, how grounded she is in her medicine and science, and she's on her way in carving history. But the great thing about her is this: she also is someone who brings people along. So she brought along another colleague. Why should one just be standing when you could add another person and become 2? I like that. And so the other person that I want to introduce is another man who is carving out another space in history. And that is none other than Dr. Caleb Cloggan. And he is a second-year endocrinologist resident at the National Endocrinology Institute in Havana, Cuba. He graduated with honors in July 2014 from the University of Havana. And after that, he went back to Guyana to apply his skill sets. And he served as a government medical officer until September 2018, when he was offered a full funded government scholarship to further his studies in endocrinology. He runs a very active medical blog. So after this session and this program, you can look Dr. Caleb Cloggan up on Twitter, on Facebook, and I'm going to later on in the session to let you tell him, he tell us where we can find him. But check this out. He is a pioneer in his field, and he is on to do great things in his country. So a very big welcome also to Dr. Caleb McCloggan. Hey, Dr. Caleb, how are you today?
Hi, Miss Ita. I'm great, and thank you very much for that splendid, quite articulate introduction. I'm doing great so far.
Very, very, very good. So tell me, with all that you do, my first question is, what do you do for fun?
What I do for fun? Actually, I am one of those persons who I'm considered to be one of the millennials, you know? So what I do for fun may be different to what you do for fun. I'm kind of have a personal obsession with the beach relaxation, like on the beach. I love the gym, and I spend most of my free time, because of this COVID-19, actually online, sharing information about how you can protect yourselves, trying to get over how persons with endocrinological disorder can actually prevent and protect themselves also from actually contracting this deadly COVID-19 virus. So my spare time is actually dedicated right now on Facebook, on my social media, sharing information on how we can actually beat this deadly virus.
Perfect. And Kelecia, what do you do for fun?
Well, for fun, I like to travel, see new places, meet new people. But with the coronavirus disease that's very rampant right now, I'm not able to do that. So I try to stay home and, protect myself and to spread the word about coronavirus, make sure that my patients take all the preventative measures that are necessary. I read, I look at medical documentaries, medical series, enhance my knowledge until things go back to normal. Hopefully that's true.
Perfect. Now, for families watch us on these webinars, and we always like a little takeaway where maybe later on in the day, educators think, oh my God, something that was shared as a snippet for my students, or a family thinks, Eureka, here are two dynamic scholars or medical practitioners that just might inspire our children. So share with us, both of you, what was that turning or tipping point in your life that you thought, hey, I'm going to go into cardiology, or I'm going to go into endocrinology?
All right, I will go first. Yes, what may have happened after graduating and leaving Cuba here in 2014, I did, which is compulsory. Once you're a foreign trained doctor, you have to do an 18 months rotation in Guyana before you're actually given what you call like a full registration that you can practice independently and everything, right? So after that, I was placed in the internal medicine department. And I have noticed something very, very astonishing during my stint there, is that the majority of my patients that were on the ward, they were diabetic. And after investigation, I found that we had a very, very high prevalence of diabetics in our country. And that was like 18%. And that was on the raw data that we had without any in-depth investigation, which is actually saying to me, in every 100 person that is that we take out from my population, 18 of them may have diabetes. And in addition to that, I realized that almost all of my patients on the ward had kidney failure secondary to diabetes. And this is not me pretending or making up figures. This was what I may have experienced. So One of the things that I noticed at a point in time that we had no Guyanese endocrinologists. We had a Cuban specialist who was there, who was on mission, who was actually doing her 2-year stint. And after that, there was no one. And I saw the need to get specialized training, and no one wanted to do it at that point in time. And owing to the love that I have for internal medicine, for diagnosing stuff and so on, I decided to venture off into that. And by virtue of that, when I'm finished here, I'll become Guyana's first, or actually the first Guyanese endocrinologist in my country. So I will be attacking firstly the epidemic of diabetes in my country, thyroid dysfunction, infertility, among others. But my main target, as if you go to my blog, you will basically be able to see that my main target right now is still focused on diabetes, since diabetes is the base, as I said, the most one of the leading cause of kidney failures, one of the leading causes of blindness, one of the leading cause of some of the cardiovascular problems that we have in the world, one of the leading cause of strokes. So by virtue of that, by attacking the cause of this, we'll reduce the numbers after the numbers of all the complications of that, of all the extended diseases. So yeah, that's my reason.
Okay, lived experience. Nothing beats lived experience. Kelecia.
Nothing at all.
Right. Well, for me, so cardiovascular disorders is the #1 cause of morbidity and mortality worldwide. So for me, studying cardiology was a no-brainer. It's something that I can, focus on. There's scope in it. I can help many patients. Lots of people are hypertensive. Lots of people have heart attacks. In my country, there is one Guyanese cardiologist, and in the capital at the #1 referring hospital. But in all of the other outlying regions, there is no such department. There are no such specialists. So my decision, it was very simple. You have the #1 cause of death worldwide. You have a lack of doctors in Guyana, and that basically, a lack of specialists in the field, and that basically motivated me to, do that special.
That's an excellent point that you both made. Oftentimes, as you know, and I'm going to speak in the African diaspora or the Caribbean diaspora, or even here in Toronto in our community, we encourage our children to be doctors and lawyers in that type of professional class. But what I'm hearing from you is that you are further informed by a need in the world. So it is just not to get into medicine because maybe it elevates status. You will help people, that's understood. But what I'm hearing from you is things that you've actually experienced, the needs of a society that you're responding to. So you're almost putting people first before profession first. So we welcome your generation of doctors who will look at people-centered medicine as opposed to big corporate medicine, if you will. Now, I want to now then ask this question. Currently, you are residing and studying in Cuba, and I want you to share with us, and I will go first to you, Kelecia, give us an update, if you will, of what's taking place in Cuba, whether you want to speak to it from the point of view of COVID and cardiology, or you want to give a general overview of what's taking place in the country. How is the country responding to COVID and some of the things that you are witnessing today?
Okay, so Cuba has a very good healthcare system. When I was deciding to venture off and to study medicine, there's a lot of things that you have to take into consideration. The different healthcare systems around the world and a third world country. So then you have to look at, okay, let's say, for example, I go to Switzerland to study medicine. they have an excellent healthcare system, first world country. But when I'm finished studying there and I go back home, will I necessarily be able to apply everything that I would have learned in Switzerland and practically make it work in my country? And then on the other hand, there's Cuba, a country with a healthcare system very similar to my own, that even though they have so many limitations that we all know, the blockade between them and the United States, even though they have these things going on, they still manage to have mortality rates that are very low and that are on par with other first world countries. So that basically motivated me to come here and study. Now, in terms of coronavirus, the first case of coronavirus was diagnosed here on the 11th of March, and they were 3 Italian tourists. Now, since the 11th of March, the country as a whole has diligently worked to prevent the spread of the disease and to keep the cases to a minimum. Initially, there were cases per day. And now, because we have 6 cases only. And when I refer to the country as a whole, I'm not just talking about this. It starts from the government. It extends to the infectious disease specialists, the epidemiologists, and these are the people that are on the forefront of fighting the infections, all the other healthcare professionals, and even the population. The people in themselves are very cooperative. When coronavirus first started, there was a bit of a controversy in terms of wearing face masks, you know, and the organization and the CDC, you should put on the face mask if, you know, if you're sick or if you have symptoms and stuff like that. From day one in Cuba, everyone was advocating for face masks. I was still in that controversy period. One day I went outside to take out the garbage, and the garbage man was telling me, hey, where's your face mask? So basically, Cuba as a whole, they have this structure and this foundation that it's easy for things to fall into place and for them to get the strategies in place to get the numbers of COVID down. They implemented a protocol, a national protocol for use by healthcare workers, where they defined, you know, the different types of patients that would probably cause a bit of confusion. What is a contact? What is a suspected case? What's a positive case? Then they went on to talk about, you know, prioritizing and treating and building up the immune system of risk groups, like pregnant women, like people in the old age homes, like people that immune systems are suppressed, like children with other comorbidities and other intellectual defects, people in psychiatric hospitals. And they started giving them drugs that were implemented here in Cuba, like Prevengavir, and one of them is also called Biomodulin T. And all of these things were created in Cuba, and they're immunomodulators or immune boosters that they give to the population to prevent them from getting coronavirus. So I think everything that they've done so far is applaudable, and I'm proud to be here, and I'm proud to be a part of the fight.
Oh, thank you for sharing that. Dr. Caleb, yes?
Yes, Ms. Aita. So not to repeat a lot what Dr. Kelecia Niles may have said, Cuba, like she said, that the people here, the populace, they're health conscious. It's like you don't have to tell them. Like sometimes when a patient comes to you, and that is something that we're trying to spread worldwide. So these patients know more about their disease than the doctor. And this is how we are trying to promote medicine in Latin America, in the Caribbean, you know, worldwide, that patients need to educate themselves. So the moment, since the 31st of December, after Taiwan may have written to China concerning the possibility of a pneumonia of unknown causes, and everybody was trying to be tight-lipped about it. So the minute that Cuba got the word, they started immediately to transmit information to the population via the radio station, via the television, and of course, through the medical channels. We were informed, we were preparing ourselves mentally for the hit. We were expecting it to hit. We were expecting it to hit harder than the 2002, 2013 SARS that wiped through Asia. Over 8,000 persons were infected with a high mortality, with I think of over 10 to 20%. So because of history, because of what we may have learned, right? We were mentally prepared. Things were being put in place, and the moment the first case, as Dr. Niles mentioned, arrived there on the 11th, the 3 Italians, right away, measures were put in place. They started to close down the provinces. Everybody started to wear their face masks. They started to give us immune boosters. They started to say, they give you the option, especially as a foreign student, they give you the option also. Listen, if you wish to work, to be on the front line to combat this virus with us, you can work, but you have the option to isolate yourself. Now, our embassy took the stance also to say to us that, listen, we also believe that if you don't feel protected from the virus, you have the option also to stay at home and isolate yourself. Or if you wish, you can work. Now, some of us, like Dr. Niles, we decided that, look, we're gonna battle this through. We're not gonna isolate ourselves completely. We're gonna do a partial isolation, like what the system is allowing us to do. And we continue to do our own calls and whatever they call upon us to do, just to combat this. In addition to that, something that was so amazing that I have seen here, in addition to the fact that every single person that I'm seeing in the street having on a mask, every single person, I have not seen, I can tell you since around the 23rd of March to now, one child in the street playing, one child in the street even walking or accompanying their mother or a parent to get something at the shop. So Cuba has taken all of these measures. They have literally, like, you can go into any market to get your vegetables, and at the gate there is bleach water, there is alcohol there for you to sterilize your hands. At some business places, they're even what you call them, stepping pans to actually sterilize your footwear and so on. So on, everyone is complying, like you don't have to tell them. These persons, they're so conscious. It's like if you try to talk to a Cuban and you take off your mask in the street, or you try to eat in the street and they know that, look, this person, have their mask on, they alert you. From the young to the old, will say, man, look, don't do this. Try, let us fight this together. And this is something that I'm seeing that is lacking in a lot of countries. And the last point I want to make, which is very important, that is that in order to combat this COVID and to combat it with this amount of success, the persons who are leading these countries, they need to lead by example. If you can observe two things, two of the major countries being affected in the Americas right now are Brazil. I'm not trying to get political, I'm just making a reference. Brazil and America. They are being affected the most because their leaders to this day are still saying, or they still believe deep down, and some of them are still saying it publicly, that it's a common flu. But we have never seen anything of the likes in the history of mankind. Yes, we had the Spanish flu in between 1918 to 1920 that took 50 million to 100 million persons based on calculation, right? However, we have never seen anything being transmitted by the means this new virus is being transmitted. Imagine it's actually entering the body via the eyes, right? If somebody simply pass gas, or like somebody farts, it can actually be transmitted that way. If you're running and somebody's running behind you, it can be transmitted that way. Now it's being transmitted via domestic animals. We have never seen anything like this, and every day we are learning about it. I'm so proud to say that I'm in a country where not only the government, but the populace also are very much 100% involved in the management of this COVID-19.
We started out the interview by talking about communication and word and mouth, and that's how we are having this gathering today, and I'm in the presence of greatness. And so when you share with us the communication efforts of the Cuban nation in terms of informing its nationals, and then the discipline that the country demonstrates, that's a fantastic thing. As you are also sharing with us, I couldn't help but think of two things. That out of war, what we know, we produce some of the best doctors ever, because the things that they see and they experience in wartime, you have to be so innovative to respond to them. While you were speaking, I was thinking of Dr. Norman Bethune and his work in places like China, or his passion of having a people-centered medicine, if you will. But what I'm hearing out of this is what you're sharing with us, that in adversity, medical practitioners in Cuba and some like-minded people around the world will emerge out of this COVID even stronger, because the challenges that present itself compels you to be as innovative and as persistent as possible. It's an incredible, unique place that you are in history. What I want to now speak about is, as you are aware, in North America and in Canada here, we've had this massive loss of our elderly. Some people say it has now made the world, placed the world's attention on taking better care of our parents and our seniors. Some people question whether it's corporate greed and having people live up all in these big buildings called senior residence. There's so many theories. My question is, what has been the Cuban practical approach in addressing the seniors or needs of elderly people within the society? That's a big piece for us wrestling with. And then the frontline workers that also work in particularly with the elderly.
Okay, so in Cuba, in terms of the high-risk population, people with a depressed immune system, for example, people that have HIV, people that have diabetes, people that have cancer, older people, psychiatrics, people in jail, all of these risk groups, they made sure that they targeted them in the protocol. That's actually the first group that they spoke about. So first of all, what they did was, these people that are in these isolated institutions, like let's say you have an elderly person in an old age home, there's no more visits, right? They closed off, nobody can enter. You can only take probably food supplies to them. And they're giving them the immune modulators, as I said before, the prevengavir and immunoglobulin T, to make sure that their system is resistant. In terms of the workers, they lengthen the period of time that they would have to be there. Like, for example, in the IPK Infectious Disease Institute, what the workers do there is that they have 15-day shifts. So they would stay there for a period of 15 days, then they would leave and go home. And upon entering again, they would test them just to make sure that these people, those workers that are in contact with the virus, don't propagate it. So these are just some of the things that they have been doing to make sure that they take care of the risk population and to make sure that they prevent the spread of disease. And I think it's great.
Yeah. Dr. Caleb, Dr. Cloggan, Dr. McCloggan, that's what I should really call you instead of Dr. Caleb. But Dr. McCloggan, something you said about Guyana, and you talked about the high rate of diabetes, and that is not anything that is peculiar to Guyana. That is something that we see within the African diaspora. We are wrestling it with here in Canada and Africa, America, when people speak of pre-existing conditions, your mind often goes to things like diabetes. And we are seeing more and more people. It doesn't matter. At one point when I was a child, which was like yesterday, people who had strokes were really elderly people. Now today, it doesn't matter what age you are. You can be a victim of diabetes. So again, my question is, how and COVID, we are told, seem to attack or it's prone to deal with people with these pre-existing conditions or diabetes. What is it that we can do, or what is happening in Guyana in spaces where there's a high level of diabetes? How can we manage that? And in light of what we are seeing, where COVID seems to be attracted to people with these pre-existing conditions. What is your take on that? What can be done, or your thinking around that?
Okay, Ms. Aita. First of all, there is no concrete data. This is something that I have done extensive research on to show that someone who is diabetic is more prone to contract the COVID-19 in comparison to a normal person. That's the first thing I want to make clear.
Good.
The problem as it relates to a diabetic person is that they have a pre-existing condition that compromises their immune system, especially when it's uncontrolled. I need to make this clear. You can be diabetic, but if you're well controlled, like your glucose level or your sugar level in the blood is within its normal range, that basically narrows the gap of you actually having complications if you should contract the COVID-19. Now, there was a study that was done by Mount Sinai University of Medicine, where they actually found that in comparison to 6% of hospitalized patients, or patients that needed hospitalization or ICU care, who had no pre-existing condition, and their pre-existing condition that they did the control with was diabetes. So what they found, that, all right, 100 persons with no pre-existing condition is actually admitted into ICU, and 100 persons with diabetes who are admitted into ICU. Now they found that the mortality rate, or the probability of persons dying who don't have diabetes and those who have diabetes, was an alarming 6% of persons who don't have diabetes died, in comparison to 40% mortality rate in the diabetics. So that is actually what is alarming, is that the minute someone who is diabetic goes to the ICU, the probability, if let's say 10 persons who are diabetic go to the ICU, means that roughly 6 of them will go home back, and 4 of them will go to the morgue, without trying to use any euphemism here. But in addition to that, now I did a live as it relates to this before, trying to educate some of my followers about what they can do to assist these persons. And what I may have mentioned didn't only work for diabetic patients, but as Ms. Niles may have mentioned, for the elderly, and also for other persons who have their immune system compromised, or may have had other pre-existing conditions like heart, like a stroke, or may have had some heart disease, or whatever the case is. So normally that person, especially during the crisis that we have right now, should be in isolation. It's not a mandatory isolation, but it's simple. You find a ventilated area in the house where you can put that person there, give them their own chair, give them their own dwelling area. I know it's a bit uncomfortable because you like the fact that you go home, you need to hug and greet your mom or your dad, you need to kiss them, whatever. But because of the fact that protecting their lives is more important than that show of affection in this crisis, you have to do it. That person needs to have minimum contact as possible. In addition to that, one person should be attending to that individual. But if the person, as I said, is diabetic or over the age of 60, or has some other immune compromising disease, that person should be there. One person attending to them. That person, the area that they're using should be sanitized regularly. All of the utensils that they're using, that should also be sanitized regularly. In addition to that, we recommend that you monitor them for any alarming signs, like if they spike a fever, if they have any itching in the throat, and to alert the hotline. And the hotline, because of the fact that they're high risk, will take immediate measures. But they need extra protection. That is something that I see Cuba is actually doing. I have like my tutor who is assisting me with my thesis. She is great. I've never met anyone in my life that intelligent, this intelligent. And the fact that COVID exists right now, it's a pandemic. Cuba has taken the stance where doctors or nurses over the age of 60 are not presently permitted to work in the hospital, just to protect them, just to keep them as far as possible away from it. All they're so knowledgeable. What we do consultation by Zoom, by WhatsApp video chat, whatever the case is. But all of these measures are being put in place just to protect them. I hope my response was quite articulate and to the point.
No, it is. The beauty about all of this, and the beauty about speaking with you again, is seeing leadership from other places in the world. And right now, a lot of eyes are on the Caribbean region. We always knew that great leadership is in the Caribbean. But what COVID has done is to just expose all those things that we knew, but were invisible. And now this thing has made them all very visible. We have one question for you from one of our listeners. And for those who are viewing in, I am in conversation with Dr. Kelecia Niles and Dr. Caleb Cloggan out of Cuba, and they're giving us updates about what's taking place in the nation of Cuba, but also too in their fields of cardiology and endocrinology. And the question from Roger is, what treatments or medicines are you currently using? And of course, everybody in the world is talking about the drug that everybody in the world is talking about today. And also, could you also share information around interferon and its role in COVID?
Okay. First of all, I was expecting that question. It's not really a top secret here in Cuba. It's something that, because of the fact that we don't have published research in it, it's not like public knowledge. But what happens? Now, if someone is actually being admitted for COVID-19, there's a protocol whereby you start them on the interferon. Now, interferon alpha is a drug that was developed right here in Cuba in the 1980s. Right? With a lot of benefits. It has been shown, it has been proven, it has been used in China in some patients for the treatment of the COVID-19, but it's not being used worldwide. But as you can see with our mortality rate here in Cuba with 4.07, this is our 6th day with no deaths, right? You can tell that this drug or the protocol that Cuba has employed here is working tremendously. Now, if the person is admitted and they're showing symptoms, normally that patient would be started on interferon alpha. That person would be using that medication 3 times a week for a matter of almost, if I can recall clearly, a month. It can be up to 3 months. In addition to that, we start them on hydroxychloroquine. This is the drug that Mr. Donald Trump
you
seems
said
to
the
be
word.
using.
You said the word.
The
word that everybody's saying today. Oh my God, it's a whole new word in our vocabulary now. Hydroxychloroquine.
Yes, we're actually using that 1 tablet 2 times a day for a matter of 10 days. And there's another drug by the name Kelecia. We'll be using two of that also, 1 tablet twice daily for a month. Now that is a combination of drugs that we normally use with other necessary supportive care like oxygen and so on if it's necessary, based on oxygen saturation. And that is for persons who are admitted. Now, if this person complicates, worsens, which is very rare in most cases here in Cuba, then what we do, we send that person immediately to the ICU. Now, when they go to the ICU, we take away now the interferon and we incorporate another antibiotic that's very commonly used in the world, Rocephin. All right, now incorporating that also, and we incorporate anticoagulant medication because of the fact that most of these persons who complicate seems to have something that's called CDI. All right, so those are some of the measures that we take. Now, if someone may have been in contact, because here they do tremendous contact tracing, and I must applaud them for that. One person, just one person, sometimes the contact trace brings out 33. If you check cubadebate.cu, Cuba Debate, or debate with the E at the end, .cu, you will see that they publish daily there how many cases they get. And details, sorry about that, details about who they may have been in contact with, the number of persons, and the measures that are being taken for each and every one of these cases.
Wow.
So if you were in contact, these persons also, we put them on treatment. They start them also on interferon, they start them on azithromycin. And this is during the time when they're actually in isolation. The contact trace persons, actually, they're isolated. They're not like, you know, they go to institutional isolation, you admit them, you observe them, you check their vital signs, you make sure that they don't show any signs of fever, anything of the sort, and you follow them until the 14 days. So some of them may be 21 days isolation, it depends. But with that, we have been making tremendous strides. As you can see, with our mortality rate, we can boast about it right now. That is 4 point something. It's the lowest right now, I think, in Latin America. If you look at any country with any significant amount of population, we have the best so far. So yes, whatever they are doing, the epidemiologists, the intensive care specialists, the internal medicine specialists, they're doing a great job, and we are seeing great success so far.
Yeah. Kelecia, you want to weigh in on that, and from your work?
Yes. So in terms of coronavirus in patients with cardiovascular disorders, the probability is higher that if a patient with a cardiovascular disorder contracts coronavirus, that they would be severely ill in comparison to someone who doesn't have comorbidities, and they may even die. So for a patient that has a known cardiovascular disorder, it is recommended that that person isolates themselves. You know, they use their face mask. They take all the preventative measures that we already know. Even if they're an essential worker, in Cuba, they're allowed to stay home. And they need to make sure that, as usual, they take their medication, and they need to get in some sort of cardiac rehabilitation, whether they do a little walk, a little jog around the house, close by, and just make sure that everything with them is up to date. They prevent getting coronavirus, and they keep their pathology under control. And in terms of the list of medications, Cuba has 20-something drugs that they have been using on patients with coronavirus. Actually, they're using the drugs from the community level, and it reaches all the way up to patients with coronavirus. The Prevengovir in the community, the biomodeling T in the community, the interferon alpha, the Kelecia, the hydroxychloroquine, azithromycin, oseltamivir. There's a whole wide list of drugs, and they have them placed at strategic points, you know, so that the patients that need them will benefit the most.
Mm-hmm. So again, what you're sharing with us too is intentionality, discipline, practice. When I visited Cuba, and I always tell people, the person who was driving me around or whatever that person, I always felt like they could fix my eye, you know, or you know, take out my tonsils on a good day. I was so impressed with the quality and the caliber of work and training, even in terms of the arts and culture, the competency of the musicians on the streets or wherever. And speaking of that now, one of the things too that Cuba is known for is its explosion of culture and the richness of culture and music and in the arts. And you are in a region which is largely a tourist destination, from Barbados in the Northeast all the way down the line. I know Guyana's in South America, and I know Guyanese are listening right now to pop me if I said Guyana is the Caribbean, but it is in South America. So how will countries in Cuba respond in the absence of tourism? You have an embargo, that's one thing, but now nations in the Caribbean are struggling with what to do next in the absence of tourism. And what influence will that have in our eating, a lot of times in in certain tourist destinations, you see the supermarkets reflect the foods of the world because people come from North America. And do you know what? After they have a swim, they want to have a burger because, hey, that's what they have back home. So how do we now operate in a new world where countries are going to be very impacted because of the lack of tourism, but all the byproducts that come out of that, or shopping habits or eating habits, all those things. What are your thoughts on that and how Caribbean countries and CARICOM navigates that?
So tourism is a very, very important part of the Cuban economy, and it actually helps the country to stay afloat. But the good thing is that they prioritize the health and the survival of their citizens over the economy, and that's not something that you're seeing in other countries as a comparison. And it's very good that they're doing that here. So right now their priority is the COVID-19, to stop the transmission and to keep the cases down to a minimum and probably get it down to zero. There have been talks amongst the members of the organization, the World Health Organization, and they were making comments as it relates to coronavirus becoming something endemic. We don't know yet what's gonna happen, but we hope that maybe someday things start to go back to normal, travel opens up, eating food in public places no longer becomes something to be scared about. But we're at a position right now that we don't know. So what we need to do is work with what we have at hand. Work on the coronavirus, make that a priority, make health a priority, and hopefully if we get that under control, then things can go back to normal. If it becomes endemic, at that point in time, we're gonna have to deal with that.
Mm-hmm. And when you say endemic, you make me think of HIV/AIDS, where it's, I didn't even want to go there, but it's not something that you necessarily have a cure for, but we've created things of how people's lives can have a better quality of life. We are still in search of how to erase HIV/AIDS, but at the same time, we have created medicines and drugs and things so people could have a better quality of life. So when you're speaking, I'm thinking about that example in relation. Dr.
That is a perfect example.
Oh, I can be a doctor then too. Oh my gosh. Thank you. That's my turning point in life. How did you become a doctor? Well, Dr. Kelecia Niles, when she was in Cuba in 2020, he made the point that I got it, and so, hey, here I am now at Rutgers University running the world, Any thoughts on Dr. Cloggan? If you were to speak to the leadership of CARICOM, what is that thing that you would share with them as their economies are impacted because of tourism and in this COVID time? What would your message be?
I don't know. I think because most of my medical formation came here in Cuba, I always put, I don't think it has to, I think it's just being human. You always put a human life first. That is priority. You cannot put an economy against the death of not even one person. If the economy has to crash to save, perhaps I'm exaggerating, but you cannot put a value to a life. You cannot do it. So it's like what I was saying to my country in Guyana, we needed a total lockdown since the first case came on 11th of March. But nobody seems to be listening to me. They're saying it's not possible because everything will crash with the cases. And Cuba here is actually doing that. mind you me, because of the embargo, Cuba is one of the most efficient or self-sufficient country for me in America, right? They do everything. They produce almost everything. They don't need to import most of the stuff, except for like oil and some other necessities. But they can survive here for months with what they have because they produce their own stuff. But Guyana, a country like Guyana, in my opinion, Guyana also is self-sufficient. But they're so, you see, bureaucracy is something that is hurting most parts of the world, not only the Caribbean. As you can see, this is one of the reasons why America is being affected. People are thinking more in the economy. And if we continue thinking down that line, we're thinking about economy, and not about lives, we're going to lose this battle. We need a shutdown. We need a complete shutdown, at least for 30 days. And you will see the marvels that will be, because people are not complying, and they're not wearing the mask, they're not following the rules. The only thing that keep people indoors is a complete lockdown. And that is what they need to prioritize. Forget about the economy for once, just focus for just 1 month on saving lives, preserving lives, and we will be okay. We will defeat this deadly virus.
I'm going to ask now a personal question. We operate a cultural center. And one of the cool things about the cultural center, it gives people a destination. We've seen with our membership and or people who support come to the center, sometimes they're at home, they're just a number in this country, they're a statistic. But when they come to a cultural space or a space that is connected with books and intellectual capacity, you find that they can find their names, they have a name, they're no longer a statistic. So here we are with this cultural center and all of its beauty and relevance as a destination, but we got COVID. And now we are in the rollout period, slowly open doors to have people congregate. One of the things that we see in North America, in countries, I'll use Canada as an example, it is very important for racialized people to have spaces where they can hear their tongues, their accents, spaces where people recall memory. You talked about the Spanish flu. Every time my mother opens her mouth for old timers, they take us back to the Spanish flu. As a matter of fact, old timers are recommended that we all bathe in lime juice. Have you heard that, doctors? Maybe you need to investigate and take that up. But what do we do here now with cultural spaces? What would be your advice to us with a cultural space? And it's there, and there are people that are hurting. Yes, we are bringing information to them through this electronic platform, but we also want to see people. We don't necessarily want to hug them right now or shake their hands, but human contact is so important. And the final point I want to make about this is, I worry that we live in a world where our children will be confused about what is real or unreal if we continue to use electronic platforms and people look at images and they're not quite sure if there's something that is really happening or is this a slide on a PowerPoint. What do we do? If you were in my shoes, what would you do?
Well, we can only do what we can do at this point in time. This is what we have, the electronic platform, and it's a marvelous platform, I must say, because sometime back in the day when older folks were younger, none of this was available. So I must say it's a marvelous platform, and we have to make use of it. In terms of cultural spaces and wanting to meet people, everybody is longing for that, even me. But for now, we just have to wait and hope for the best. And in this time of coronavirus that people are isolated, I see people coming up with the most ingenious things. Like I saw a birthday celebration that was in the porch. They decorated the door and they had a fancy chair on the porch. I saw a drive-by birthday celebration. You know, all of these kind of ingenious things that people come up with, and social media and the electronic platforms, what we're going to have to do for now until things get better, and hopefully they get better.
Dr. Cloggan, it is your turn to tell me, Dr. Niles is recommended. Listen to the science. Scientists are saying, don't be impatient. Don't think economics. Put people first. Maybe you need to do more electronic stuff right now. What are you telling me?
Yes, I concur with that. That yes, we need to do that. As just to add a bit to what Dr. Niles may have said, is that I've seen persons that are having virtual graduations, drive-by graduations, because it's such a special moment in life. Now, concerning cultural space, yes, right now, as some countries start to reopen their economy after complying with the 6 recommendations that the World Health Organization have stipulated, you're finding persons starting to open doors in these spaces. But what you need to do, you can go these places, but I recommend you maintain what may have been in place, not only because of this pandemic, it's been in place since the Black Plague in the 13th century. Social distancing. Go. You can go, be in the common space, but you guys need to maintain that distance. Wear a mask. Wear a mask, practice social distancing, and you will be okay. Try not to touch try not to touch items. If it's just for conversation purposes, do that, right? But social distances, which has been effective during all of the known pandemics that we've had, even the Spanish flu. But in the meantime, in places where it's not possible, we have, thanks be to God, to globalization, development of technology and everything, we have the electronic platform, which has been doing marvelous for most persons. I'm sure that you heard about TikTok, right? It has been keeping us quite entertained. So persons are coming up with ways of actually, their live concerts. Like, I don't know if you heard about one of our great singers of Guyana, Charmin Blackman. She had a virtual concert the other night, and it was marvelous. She had over like 50,000 persons doing it at the same time. It was amazing. And Charmin Blackman, she's not an international artist, but she, because of the fact of the COVID, and it was such an ingenious idea, it was marvelous. We had over 50,000 persons, at one point 59,000 persons at the same time connected, enjoying. So yes, we can use the electronic platform, but at the same time, places that are opening little by little, we need to continue to practice social distances. Like I'm seeing in certain beaches in Florida, they're trying to give persons demarcated spaces 6 feet apart. A family can go on the beach or in parks and hang. That can work, but we need to also wear the face mask. Remember, one of the sources, one of the main form of transmission of this contagion is by droplets. And if we can wear our face masks for the meantime, while we try to get this under control, while we try to get this vaccine, with the great strides we've been making over the last couple of days, we will defeat the virus. So that's my advice.
What are you going to do now to shape the new world that we are going to live in? And what's your vision for this new world as individuals? What is it that you are going to add in the newness of the world? And in that, I also want to ask, what is your messaging to young people? Because sometimes they're left out of the equation. We are not paying attention to their thoughts and in their thinking. And a lot of innovation are probably going to come from them. I see in Jamaica, there are 2 young men who are making, got together. This is actually an interesting point. When one of the young men was being interviewed, they said to him, how did you get your team together to make this respirator? It's in the initial stages. And this is what he said. I thought about some of the brightest people that I knew, and I called them up. And one of the brightest people that he knew seemed to be under like 35. Oh, I love that. He's acknowledging his peers. So what is your message to young people? What's the world that you want to see ahead? And what are you contributing to design of that new world?
We were born in an age where a lot of things were already done. A lot of things were already invented, and it was just left there for us to make use of, and that kind of took away from us being inventors, from us, you know, getting our brains clicking. So there's a space now, there's a platform now for people to, for wheels to be turning in the minds of the young people, for them to come up with new innovative ways for us to, you know, combat the coronavirus and the socialization problem that we're having right now. So, you know, they say every dark cloud has a silver lining. So maybe that's the silver lining in this situation. And when you were speaking about young people, I remember I saw a picture on Facebook, and it was related to coronavirus and education and what's going to happen to the children. And in the picture, they depicted a young man sitting indoors at the computer, you know, because there's some online educational courses going on right now. And he was, you know, doing his course at home with his parents. And on the outside, there was another child that was apparently poor. His face mask was all nasty, and it appeared as though he didn't have access to the internet. So we have to keep working on strategies, on more strategies to target all the different kinds of youth, those that are fortunate, those that are less fortunate, and make sure that everybody has access to, you know, the education that they need.
Fantastic. Very brilliant, very nice. Yes. Yeah.
Yes.
Yes.
So,
Cloggan.
this pandemic has brought out some very important details of our lives, things that we take for granted, like family, like enjoying the outside, you know, just a simple walk, breathing the fresh air, taking a swim, taking a walk on the beach, bird watching, traveling, like what Dr. Niles liked to do. This has shown us the value of family, of a simple hug, of a simple handshake, of a simple, like what we do in Guyana, we pound in the Caribbean, we pound, right. Of a simple embrace. In Latin America, they have a way of greeting that they hold hands and they give a smack on the cheek. Over the last few months, we have noticed the importance, the value of these simple social contacts, simple cultural amenities that we should be cherishing, that we took for granted, that I'm sure when we get over this COVID-19, which I know we will, that I'm sure we will not take for granted again. Secondly, something that not only is not the word of Bill Gates, it's something that I may have been preaching even before I heard him saying it, and what Barack Obama may have said, we need to prepare ourselves for the next pandemic. I'm a guy, I believe, we must know where we came from, our history, we must know what we're going through presently in order to determine our future. 1720, we had the plague. 100 years after 1820, we had cholera. 100 years after, which is 1920, we had the Spanish flu. Now we are with COVID-19 in 2020. I'm just trying to draw parallels so you can see that we need to prepare ourselves. As the young ones, we are living it right now. We have the opportunity to live through a pandemic like this. We have the necessary technology. We have the knowledge as youngsters. We have, based on my calculation, based on pattern, it can be sooner, it can be later, that we have 100 years to prepare for another major one. But that doesn't mean that we will not start from today to try to put measures in place. And one of the reasons why Taiwan is one of the countries is only, I think, 430 cases to date with, I think, 9 or 8 deaths, is because Taiwan learned from their history in the SARS 2002-2013 epidemic that they had. They learned. So they prepped, they put things in place. They had 2,000 negative pressure beds ready and waiting just in case of this, and 20,000 isolation beds just in case something of the same nature may have occurred. And Taiwan's model should be a model for the world, a model for us as youngsters to look at and to learn, that we need to be prepared. If we're not prepared, then we should prepare ourselves to fail. So that's my message.
We started out the conversation speaking, and when I introduced Dr. Kelecia Niles and Dr. Caleb Cloggan, I said that one person introduced me to Dr. Niles, and then Dr. Niles brought you along. And that theme of bringing others along has resonated right throughout our conversation. I want to thank you both. I know you're super, super, super busy. But right now in the world, those people who are looking at you, those people who will receive you later, because our webinars are recorded and then we archive them on our different platforms. I think that they're going to appreciate your expertise, your wisdom, but you keep taking us back to the fundamentals too of life. You've encouraged us to value our family relationships, or those simple cultural things that we may take for granted as human beings. I thank you for reminding us how innovative that we can be. I also, it is so important. I remember during, again, I'll use HIV/AIDS as an example, going to Zimbabwe, and what the difference it made that my colleagues and I could speak to fellow Zimbabweans about HIV/AIDS. Not that we were experts or practitioners, but just to say to people, as people of African descent, to other people of African descent, this illness will affect you. You will not be immune from it, but it will affect you. So in you conversing with us and the world sees your leadership, there may be ears right now that are not listening to all of the advice that we're being given in the world. We might even see advice being given in the world, which might not be factual advice. So we're conflicted, we're confused. But when we see dynamic of people like yourselves who are not theoretical, but you're actually on the ground floor of medicine, then people will listen. And that messaging, the simple messaging of wearing the mask, washing the hands, your physical distancing or social distancing, depends on what side of the Atlantic you live, right? Maybe we will be more mindful of them because it comes from folks that look like us and folks with no interest in having experiments done on our people for the sake of experimentation sake. I hope that in all your graduate studies, you continue to excel. I hope that the leadership of the Caribbean embrace your voices and the voices of many like you who are across the Caribbean. I hope that the Caribbean will replace tourism with a movement of medical practitioners like you, who, just like the vision of Cuba, will be able to go anywhere in the world in a pandemic time and an epidemic time and any kind of time to just help other human beings in this world. I salute you of being one of 4 cardiologists in the great nation of Guyana. Dr. Niles, I salute you, Dr. Cloggan, of being one of the first endocrinologists in the country of Guyana. We look forward to welcoming you here in our great city of Toronto to share your news, your messages, and your expertise with our nationals. But most importantly, we wish you well in every single thing that you are doing and are about to do. Continue to write your names on history's page. I see that your expectations are very great. Thank you.
Thank you, Ms.
Thank you so much. It was a pleasure. Thank you for having us on this powerful program, powerful platform.
Oh, yes. Lots of love, and you have opened up my eyes to so many things, even in terms of a simple thing like this of wearing the mask. Some days I do, some days I don't. But all the time that you were talking about the importance of masks, I was writing my little mental note. You got to wear that mask all the time, girl, all the time, right? So it is, I am just so honored to have met you. And I'm also particularly pleased that my mother of 87 years strong had the opportunity of hearing you, and that my daughter, who is in the becoming of a midwife, also had the opportunity to be in the company of people who are in the field of medicine.
Wow. Great.
That was awesome. Thank you so much.
Yeah.
Excellent. Yeah.
Thanks for having us.
I am point. Thank you.